Hi, my name is Kevin, and I will be performing a physical exam on my patient here. Go ahead and introduce yourself.
My name's Caitlin.
I'm going to go ahead and start off by using some proper hand hygiene while I ask my question. The mental health portion of this exam. Can you tell us if you've wanted to kill yourself or hurt yourself in the last 72 hours?
No.
Any thoughts of not wanting to wake up?
No.
Any depression?
No.
Any anxiety?
No.
Um, any mental health that runs in the family?
No.
No patient declines all of the mental health questionnaire. I'm going to go ahead and move into the physical portion of the exam, starting with the neurological. Can you just go ahead and tell me the date and the time?
Today is November 28th, 2023, and my name is Caitlin Andrade.
Okay, can you go ahead and tell me what month we're in?
We're in November.
November. Okay, great. Can you tell me where you're at right now?
I'm in a clinical setting.
Great. Thank you very much. Patient is alert and oriented times 4. Can you go ahead and tell me why a water and a lake are very similar to each other? Or
They're
ocean and a lake are similar to each other?
they're in a body of water
Great. Can you tell me why apples and oranges are similar to each other?
because they're fruit and they're round.
Great. So patient can think abstractively. Let's see. Can you go ahead and repeat these words for me? Tape, remote, and control.
Tape, remote, and control.
Okay. Can you go ahead and repeat those words for me?
Tape, remote, and control.
Okay, great. Patient has short-term and long-term memory. Let's see here. I'm gonna go ahead and start by assessing the head and neck of my patient. So just looking here, I don't see any signs of hair loss, any tenderness. Does this hurt at all?
No.
No? Okay. Skin appears normal. Face looks symmetrical on both sides. No facial drooping to one side. No eye swelling. Let's see, the lips look pink. And at first glance, I don't see any issues with the ear. Let's see here. Now I'm going to start by assessing cranial nerve number 7. Can I have you scrunch your face for me? Okay, puff out your cheeks. Okay, great. Let's see, we're going to do the same thing here and test cranial nerve number 5 and have you just start doing a chewing motion for me. No pain here?
No.
Okay. Any pain here in the back?
No.
No? Great. Okay, so I'm going to go ahead and use my ophthalmoscope to test for eye function. I'm going to dim the lights here a little bit. No issues there with the retinal function. I'm going to go ahead and take a look at your pupils now. Okay, both pupils, both eyes are round. They're reactive. They accommodate to light. The sclera is white. Let me go ahead and check the conjunctiva. Conjunctiva is pink on both sides. Now I'm going to go ahead and take a look at the nasal passage here. Okay. Nasal passage is clear, no drainage at all. Lips are clear as well. I'm gonna go ahead and now test for accommodation. Go ahead and just follow my pen light here. Okay. Okay, no signs of let's see, strabismus. Patient accommodating well. Let's see here. I'm gonna go ahead and check for nasal function. If I can have you close your eyes, we're gonna check olfactory nerve 1, cranial nerve 1. Go ahead and tell me what you smell here.
Cherries.
That's correct. Thank you very much. Okay, cranial nerve number 1 is intact. Now what I'm gonna do is test cranial nerve number 8. I'm gonna have you cover your ear here while I whisper something.
Apples.
All right, thank you very much. I'm gonna test the other side now.
Bananas.
Great, thank you very much. Let me go ahead and have you stick your tongue out for me. Go ahead and stick your tongue out for me and go ahead and wiggle it side to side. Okay, cranial nerve number 12 is intact. Can you stick your tongue out again for me? Let me grab my knife. Okay, the tonsil is midline. Let's see, go ahead and lift your tongue up for me. No signs of oral lesions. The teeth are all intact. Now I'm gonna have you stick your tongue out one more time. We're gonna test for the gag reflex here. All right, thank you very much. Cranial nerve number 9 is intact, the gag reflex intact, as well as number 9 because she can swallow and she can talk. Okay, now I'm gonna go ahead and test for cranial nerve number 12 here. If I can just have you shrug your shoulders for me. Okay, shoulder strength is 5 out of 5 and cranial nerve number 12 is also intact. Let's see here. I'm going to use the ophthalmoscope now to check the ear here. First off, does this cause you any discomfort?
No.
No? No pain when I touch the ear. There's no redness on the outer portion on the tragus. Now I'm going to test the ear. There's just some cerumen noted, but everything seems looks okay here. The membrane also looks intact. It's pearly white. Let me check on the left side. Again, just some cerumen, pearly white on this side. The cone of light is towards the 7 o'clock on this side and the 5 o'clock on the right side. Okay, next what I'm going to do, let's see, I'm going to check the skin. Go ahead and lift up your sleeves a little bit for me. Let's see, no lesions at all. I'm going to check for the brachial nerve, the artery here. Just checking the pulse. Great. Great. Radial nerve, brachial nerve here is intact as well, the artery, I'm sorry. And then let me go ahead and check for the lymph nodes of my patient. Just checking for any masses here. This is the preauricular lymph node. Nothing there. Postauricular, nothing there. The submental, nothing there. Submandibular, let's see, no masses palpable there. The cervical, the superficial cervical, I don't feel anything here. Neither on the occipital. The deep cervical, let's see, I feel nothing there either. Now I'm going to go ahead and look for any JVD. Can you look to the side for me? Yeah. No signs of JVD on that side. Let me see this side. No signs of JVD on the right side either. Now I'm going to check the patient's carotid artery. Let me check this side. Okay, now using the bell of my stethoscope, I'll listen to the carotid to see if she has any bruits noted. Go ahead and take a deep breath for me to hold. Okay, nothing there on that side. Let me check this side. Go ahead and take a deep breath and hold. Okay, thank you very much. Now I'm going to move into the respiratory portion. Noting the chest is symmetrical. Patient doesn't seem to be in any distress of breathing. She's not using any accessory muscles here. Let's see here. I'm going to go ahead and listen to the heart sounds. Okay, looking at the intercostal space here on the left side, the second intercostal space, and then I move over here to the left side, I'm sorry. And then I'll move down here to Erb's point. Then I move down here. Can you just lift up your breast tissue for me, please? Thank you. And here. Great. This is the PMI right here, down the midclavicular line. Let's see here. Heart sounds sound normal. S1, S2 is normal. No sounds, no swishing or murmurs, heart murmurs noted. Let's see. Actually, what I'm gonna do is listen with my bell of the stethoscope now to see if I hear any bruise. Okay, heart sounds sound normal. Now what I'm going to do is move into the respiratory assessment. As mentioned, she's not having any respiratory distress at the moment. I'm going to listen for any changes in lung sounds. Go ahead and just, when I move locations, just take a deep breath for me. So starting here at the apex of the lung. Okay, breathe out. Thank you. Breathe in. Breathe out. Breathe in. Breathe out. Okay, breathe in. Take a deep breath. Breathe out. Breathe in. Breathe in. Alright, thank you very much. Now I'm going to go ahead and listen to the back of the lung sounds in the same location, starting here at the apex of the lungs, moving downwards. Go ahead and breathe after me. Again. Okay, so from what I can see, all breath sounds are normal. Let's see here. Go ahead and continue with the neural exam. If I can just have you go ahead and grab these three items. Close your eyes and tell me what they are.
Pick a pen, coin.
All right, thank you very much. Okay, stereognosis is normal. Go ahead. I'm gonna go ahead and test for the sensation of the skin. Go ahead and close your eyes for me. Go ahead and stick your hands out again for me. How do you feel? Is this soft or sharp?
Soft.
How about on this side?
Hard. Soft. Sharp. Soft. Sharp. Soft.
Okay, patient's able to feel sensation on her skin. Let's see here. I'm gonna test for, let's see here, grip strength. Go ahead and grab my hand and grab this, just squeeze my hands, please. Perfect. Patient has 5 of 5 hand strength. Can you go ahead and close against my fingers? Perfect. Go ahead and do the same thing with your thumb here. Okay, now backwards. Perfect. Let's see here. Go ahead and pull your hand against mine. The other way. Yes. Now push against me. Okay, now downwards. Perfect. Let me go ahead and do the same thing on this side. Let me feel here. Close against my fingers. Okay, wiggle your fingers for me, both sides. Great. Go ahead and put your hands towards my hand again. The other way. Great. Great. Now this way. All right, perfect. Patient has bilateral arm strength on the biceps, the triceps. Let's see here. Now I'm gonna move into the abdomen portion of my patient. Go ahead and lie down for me. Okay, lift up your shirt for me, please. Okay. So I'm gonna go ahead and listen to the 4 quadrants, starting from the bottom and moving clockwise here. Let's see, just to note that I don't see any signs of abdominal distress. Skin looks normal. I don't see any pulsation. Let's see here. Gonna start with auscultation. Patient has normal active bowel sounds. Now I'm gonna listen for the artery, the aortic artery right here. Okay, that's normal. Now I'm gonna move down to the kidney arteries on both sides. Normal there. Now move down to the iliac arteries down here. Okay, now I'm gonna move into a light palpation. Do you have any pain when I do that?
No.
How about here?
No.
How about here?
No.
How about here?
No.
No? Okay, I'm gonna move into a more deep palpation. Any pain there?
No.
Any pain there?
No.
Any pain there?
No.
Any pain there?
No.
No pain? Okay, now I'm gonna percuss the abdomen as well as the respiratory just to check for residency. Have the liver size approximated about 8 centimeters. Now I'm gonna check for the spleen. I don't feel a mass here. Okay. Let's see. So no irregular mass here on the spleen as well. Can you lift down your shirt for me? Okay, stand up for me. I'm gonna check for. Go ahead and sit down.
Oh, sorry.
Go ahead and I'm gonna check for. Let's see, residency here as well. Okay, lung sounds are resonant. Let's see here. Now I'm gonna move into the pulses here. Gonna check for the popliteal pulses. Okay. Okay, thank you. Okay, so go ahead and push against my hand here. Alright, and push against my hand here backwards. Thank you. Go ahead and lift your ankle towards mine. Great, now go ahead and push down. Thank you. Go ahead and push against my hand here. Okay, push backwards. Okay. Push up. Push down. Okay. Feet are strength 5 or 5. Knee strength is 5 of 5 as well for flexion. Let's see. Go ahead and lift your knees against my hand. And again here. Okay, thank you very much. Can you go ahead and take your shoes off for me? Okay, now go ahead and put your ankle towards my hand. This way. Perfect. Okay, now this way as well. Alright, ankle strength is 5 of 5. Does that cause you any pain?
No.
Okay, go ahead and do the same thing over here. Thank you. And do the same thing here. Now I'm testing for the pedal pulses down here. Perfect. Let me check this one over here. Alright, thank you very much. Now what I'm going to do is I'm going to actually gonna check for any CVA tenderness. So. Does that cause you any pain?
No.
Not any pain?
No.
Okay, no CVA tenderness. Let's see here. Can you stand up for me? Can you turn around for me? I'm going to have you walk back and forward. I'm going to check your gait. Okay, patient has normal gait. Go ahead and turn around one more time and walk on your tippy toes and then on your heels on your way back. Now do one more. Go ahead and do a heel to toe for me. Okay, perfect. Okay, go ahead and close your eyes for me. Go ahead and stand right here. Okay, close your eyes for me. We're going to be checking for any imbalance. Okay, that was the Romberg test that we just did. Go ahead and close your eyes again and lift your arms up for me. Straight out. Close your eyes for me. We're just checking here for any drift. If the patient drifts her arm, it'd be something like this if she had anything neurological. So go ahead and keep it there for a second. All right, perfect. Thank you very much. Let's see here. Go ahead and lie down on the bed for me, on your back, on your belly. All right, go ahead and put your leg towards my hand. Okay, perfect. Do the same thing here. Perfect. Okay, can you extend your leg all the way up to your hip? No, this way. Here, like this. Thank you. Do the same thing on the other side. Okay, now do what you did before and lift your leg up. Raise your leg. Thank you. The other side. Okay, patient's able to extend on both sides. Go ahead and turn around for me. Okay. Now I'm gonna go ahead and use the reflex hammer to test my patient's reflexes. Gonna start with the brachial reflex here, the bicep reflex. Okay, gonna go ahead and move down here to the brachiodorialis reflex. And do the same on the other side. Do the same here on the bicep. Okay, now I'm gonna check the tricep reflex. The other side. Okay, now I'm gonna check the reflex here on the knee, on the patellar, on the quadriceps reflex. Okay, and now I'm gonna stimulate the Achilles reflex. Let's see, can you turn, let me go ahead and, can you turn around for me and lay on your belly one more time? Okay, go ahead and sit back up for me. Okay, that's gonna go ahead and conclude my head to toe assessment. Patient had no abnormal findings at this time. If you have any questions or comments, please feel free to comment under my video. Thank you very, very much for watching.